Well, I'm super excited to welcome Whitney back onto the podcast, and we've got some great topics we are going to talk about today. So, Whitney, I know we talked about before we hopped on here to record, is talking about the importance of working with C-section scars and even perineal scars. So, let's actually dive right in and talk about that because I know I hear from a lot of moms that their C-section scars may bother them a little bit or they don't know what to do with them.
Yeah. So, and we have a pretty high C-section rate. And most people aren't taught anything about what to do with their C-section scars. And it's really, really, really important to work on that scar tissue. The thing about pregnancy and postpartum and women's health is we are pretty lacking in a lot of care. But most people will understand, like if you tore your ACL, which is a ligament in your knee, and so if you had an orthopedic injury and then you had scar tissue from it, your surgeon sends you to a physical therapist within a couple of weeks to work the heck out of that scar tissue to make sure you've got all of the mobility there so you can have good range of motion of your knee so you can function well. And then, of course, work on stability around the knee, the core, and then the whole body so you get back to function. A C-section is a major abdominal surgery, major surgery,
Yes.
which that is another thing. Most people don't know that. Our culture has really just minimized how big of a surgery it is. And so with any scar tissue, scars can get adhered. So there's scar tissue adhesions is what we call them, or restrictions, where the scar can get stuck to the underlying tissues or the tissues around it. So, what that means for the C section scars in particular, think about its location. So, it's near the bladder. So, it can get stuck to the bladder and cause bladder issues like urgency, frequency, sometimes even incontinence. That can be from scar adhesions. It can attach to the bowels. And I've seen some moms who end up having bowel obstruction, which is a
Oh,
medical emergency when these adhesions start to attach to the bowels. And then it can also attach to the other reproductive organs in the area. So that could potentially lead to what we call secondary infertility. It's more of a mechanical infertility because it's the scar tissue that's restricting the movement of the reproductive organs. And so those are some functional things about why it's important to work on that scar tissue. But cosmetically, I would say would be the most frequent reason why moms want to work on their scar tissue, and that is to avoid the C-section shelf. So a
mhm.
lot of moms will complain that no matter how flat they get their stomachs, they always have that darn overhang of tissue right over that scar because that scar is stuck down. And these are things that we can fix, especially if we get to it early. And so that's another thing most people don't realize. We want to get to the scar tissue pretty early postpartum. Scar tissue takes a year to go through all of its healing phases. So we want to get to it before a year mark. Now, if moms are after a year, we can still make changes to the scar tissue. It's never too late. But we'll make a lot faster, more effective changes if we can get to it before the year mark. So the scar mobilization is huge. The other fear that a lot of moms have, a lot of people, we're just not educated about what we can do for the scar. You have your
Yeah.
C-section, oh, here's your baby, go home, and there's no education about what to do with your scar tissue. And so most moms are afraid to even touch it because they think, oh my gosh, well, if I touch it, then I might open it. And so there's a lot of
Mhm.
fear around that. And we normally say we don't need to work right on the scar tissue until you're cleared. So typically you'll have that 6 week postpartum visit. And so if the scar is healing well, so there's no signs of infections, if you had any scabs, that those are all gone. So if everything's healing well, and that's well to the OB's perspective, meaning there's no infection. That doesn't mean
Yeah.
it's healing well to us because as PTs, we're looking at function and mobility. And so So then around that 6 to 10 week mark is where I typically have my moms just start with little gentle massage on the scar. And it's just whatever you can tolerate. The other thing I tell my moms is a lot of times with C-sections, there has been some trauma around the C-section too. And our bodies can hold on to trauma, especially in scar tissue. So that's always one thing I prep my moms with. I'm just like, you might just place your hand over your scar and just come to terms with it being there first. And even just doing that, you might be emotional. You might start to cry and let your body release some of that trauma. That's a very common thing to happen when you work on scar tissue. And so with the C-section scars, that's something that would be great to do even before you can start actually massaging the scar. Just like place your hand over it and just come to terms that that's there and that there's a lot of things we can do to work on it, to soften it, to make it nice and mobile. So it's typically
Well,
6 to 10 weeks. Uh-huh.
yeah. So Whitney, I love that you said that about just placing your hand on the scar and the fact that we hold trauma, emotional stuff in our tissue. I've talked about that before, and it's a very interesting topic and one that I find we don't talk about enough. And especially around birth trauma. We don't talk about birth as a trauma. And I think that that is because some people think of that as like, oh, that's a bad thing. The birth is an amazing, amazing thing that all of us moms go through. And even if we don't think of it as a trauma in that aspect, right? Because I've talked to moms, and I'm sure you have too, where because they have a healthy baby and everything else went fine, they may not acknowledge with themselves that it was traumatic for them. And so we may not consciously recognize that it is traumatic, but that's where then, like you said, just even touching your scar and recognizing like, okay, that my body can heal. And I think that's another big piece too, is no matter what your body's been through, women have been having C-sections for a long time, and C-sections are an amazing, amazing medical advance that we can do to have a healthy baby and healthy mom. But there are so many things that are not talked about and are not taught in the medical system about what to do about cesarean scars, how to prepare for a cesarean if you know you're going to have one, because there are things we can do. And then obviously on the healing side of it. So I love that you mentioned just putting your hand there and touching. And we even know that just that touch alone can actually have a lot of healing itself versus actually before even going in and doing manual stimulation of the tissue.
Yeah, absolutely. Well, and especially too, some moms will have what we call hypersensitivity at their scar tissue, where they can't even wear like a fitted shirt, like something that rubs up against the scar tissue, or maybe they can't wear leggings or they can't wear jeans because it rubs up against the scar tissue, and they're so hypersensitive to it that they can't handle anything touching or rubbing up against it. And so for those moms just starting with placing their hand there and not moving, but just placing it there, that's the first step in starting to desensitize. And so for
Yes.
those moms, uh-huh.
Well, Whitney, I wanted to definitely talk more about that. Like, what causes that extreme sensitivity? I mean, I have variations of it, but for women and moms that really cannot, like, they don't want anything touching their belly because it's so tender and sensitive, is that of actual physical, or is it more of that emotional, traumatic stress that is being
Mhm.
held in that part of the body?
Yeah, so it could be either or both. And quite honestly, most often it's both.
Both, yeah.
Um, but for some, if it's more the emotional and the fear, a lot of times there is a lot of fear too, especially at the C-section of like, oh my gosh, what if it gets infected? What if I open it? And they're like so rigid and they don't want to move because they're so afraid of of tugging at the scar or anything. So
Mhm.
so there's some of that emotion and fear where we hold that in our tissues. Sometimes there's fascial restrictions. And so, especially my moms who had like really tight bellies when they were pregnant, most people aren't walking around touching pregnant bellies. I touch pregnant bellies every day. And so there our bellies when we're pregnant should still be really soft and squishy. We should have nice suppleness to our tissue and all of our abdominal musculature and our fascia and everything. We should still be really soft and squishy. Some moms are just so tense and they have so many fascial restrictions. I find sometimes those moms are the ones, if they end up having a C-section, they have more sensitivity and discomfort at the scar tissue. And I think it's
Mm.
because there's so much pulling, like constant tugging on the scar tissue while that scar is trying to heal. And so I think that has a part. I think the adhesions have a role too. So when that scar tissue just gets stuck down, I feel like that people will have a lot more sensitivity with that. Typically, they'll have like pain even to touch it. Their baby kicks them in the scar and they're just like, "Oh my gosh, that hurts so bad." And so
Yeah.
that's another big one we see a lot of times adhesions.
So, Whitney, for women who are really sensitive and really tight, and I see that as well. I see, especially when we start talking pelvic floor specific conversation, that I see a lot of women, especially if they have a history of a lot of exercise. We tend to be really tight and we don't have that
Mhm.
fascial fluidity where we can be strong but be soft at that same time, which is getting into the fascial conversation. But what I hear you saying is that so women who even after, say after a C-section, but before maybe they're even ready to work on the C-section, especially if it's super tender or they're just so soon surgery, working on releasing other areas. So like, I teach
Yes.
the ball work like for the obliques and the low back and like the hips. What I'm hearing you say is we could probably start doing some of that really gentle work to start to soften the tissue in other areas of the body before we actually even address the scar tissue. And I feel like this
Absolutely.
conversation can apply to insert scar tissue anywhere in the
Yep.
body. And
Yep.
this conversation applies as well, right?
Yeah, yeah,
Yeah.
absolutely. And that's when like I saw a mom at 11 hours postpartum. I was working on her fascia all from right next to her spine on her back, pulling everything towards the front, taking off all of that fascial tension and restriction, some muscular as well, but releasing everything from the back to the front. Not only did we then take off some of the tugging at the scar, I closed her diastasis from 4 fingers to one. And that's
Wow.
because of all of that fascial restriction. And so we
Mhm.
can start that day one. And it's just that gentle, you just like stick down and pull. I have a little video of how to do that on a pregnant belly. It was actually when I was pregnant. And I show how to do the fascial mobility on the belly on like it was my first Instagram reel that I ever did. Um, but that's actually what I teach everyone to do during pregnancy first to try to take off some of that fascial restriction, try to decrease the separation of the abdominal muscles during pregnancy. But I have people do the same technique postpartum. And gosh, all my moms postpartum, when I do that on them, they're just like, oh my gosh, this feels so good. And it
Yes.
feels good because you're just releasing all that tension. But then that can take off some of the pulling from the scar, which then helps with scar healing. The other group of muscles I like to work on, especially fairly early postpartum, would be the iliacus. So that bony part of the pelvis right in the front. If we go just inside of that, we've got our iliacus muscle. And so that is a big one, especially when moms complain of tension or pulling that they notice at the ends of the scar. That can sometimes be from tension of the iliacus. And so just kind of sinking gently but gradually into the abdomen right next to the pelvic bone in the front, that can be really a really helpful release to do to take off some of the pulling as well. But
Yeah, and
absolutely
actually,
working on everything around it.
yeah, well, and everything you just talked about is like every mom should do, regardless if you've had a
Yep.
cesarean or not. And I feel like, and this is why I love talking about cesareans and also vaginal births because I feel like, but I like to kind of put them more in one category. I feel like
Mm-hmm.
we separate them so completely, not like you and me, I should say, society separates
Yes.
them so completely that because I get so many women that reach out like, well, but what you're teaching, is it going to work for me? Because I've either had a C-section or I'm planning to have a C-section. And I'm like, okay, that makes me so sad that women reach out to me. They feel like they're alone. They feel like, well,
Right.
but because I'm over here in this category, I'm having or have had a C-section, that I don't know if all the rest of everything that we talk about with preparing for birth and all of that applies to women, that have had C-sections. And I'm like, absolutely. Like
Yes.
and I would love you to speak to this too, right? And I know you kind of started saying, so in those early days, even postpartum, we've already said some of like the releasing the back and doing some just really gentle stuff. And when you were talking about like the iliacus, like I've not had any C-section. So personally, I don't have that experience, but I have worked with women who have, and it's amazing what we can do with scars and all the fascial adhesions. But even for myself, has had 3 pregnancies, I had a good amount after my third, and obviously it was an awareness too of learning and understanding all of the fascial stuff that was going on. But I had some really, I don't know if it was full fascial adhesions, but it was really restricted inside the front of my pelvis there. And that was very
Yes.
interesting to me. And so the reason that I just thought of that when you were saying that, because I just want to point out to moms who are listening that maybe haven't had a C-section and but are interested in learning all of this, because a lot of this also can apply to just postpartum in general. But I know I had restrictions through there that I was able to work on and work out because all those postural shifts that are taking place, there they happen whether you have a vaginal birth or whether you have a cesarean birth. So we have so many of the things that have happened during pregnancy that we still need to, we can, or we have the ability, the healing potential to work on postpartum. But then obviously, if we have a C-section, we have that major surgery and we have the added scar tissue, which can be worked with. It's amazing. I'm sure you have so many
Yeah.
amazing stories of moms that thought that there was nothing they could do with their C-section scars.
Yep. Oh gosh, there's so much we can do. And
Mm.
I, like, you are right on point with all of us going through either vaginal or C-section. We are all one group. It doesn't, I always try to make that so clear, especially when I talk about the pelvic floor, because then the C-section moms are just like, oh, well, I didn't have a vaginal birth, so my pelvic floor is not involved then, right? And I'm just like, no, it absolutely is involved. It was involved all throughout pregnancy.
Yeah.
And then postpartum, I mean, it is a major abdominal surgery. And sometimes our body can interpret it as a trauma, and our pelvic floor can then tense and guard. And so I'll see moms after C-sections with painful sex. I'll see moms after C-sections with leaking urine, so urinary incontinence. And they're just like, well, but why is that happening? The baby didn't even come out that way. And everything's connected. Everything's connected. And so, regardless of what type of birth, the iliacus, that is one that I treat the iliacus on every single one of my mom's postpartum because it tends to get tight during pregnancy and you're not able to dig in there when you're pregnant. And so it gets tight during pregnancy and then postpartum, think back, I mean now our kids are just a little bit older, but think back in those first 2 months. We are sitting all the time. We're sitting. And when we are sitting, those hip flexors, the iliacus in particular, tends to be the one that gets so tight. they're in a shortened position. And so then they continue to shorten in that sitting position. And that's when people end up getting low back pain, because then we've got tight hip flexors, which are pulling on the back. We've got some of the different postural issues that happen postpartum. And so we have all this shortening of these muscles in the front. And so I'm releasing everyone's iliacus, I'm releasing everyone's diaphragm, because that poor diaphragm was pushed up for so many months during pregnancy. And so some moms will complain of like shortness of breath after they've had their baby.
Mm-hmm.
And as soon as we release that diaphragm, then they can get a nice excursion and they can get those lungs to fill up better. And so some of these muscles across the board, regardless of what type of birth you've had, C-section or vaginal, these are all muscles, and then the fascia around the trunk, that are all impacted throughout pregnancy, through labor, and postpartum for anyone.
Yeah, I love that you helped summarize all that. So you mentioned the diaphragm, and I actually would love to talk about that for a minute in relationship to pelvic floor function, and we can also relate it to healing and or improving a C-section scar as well, because in order to have proper pelvic floor function, proper deep core function, we have to have a proper functioning diaphragm. I feel like breathing gets
Yes.
overlooked so much, and because I work with so many women who love to move, I love to move all the time. But in order to really to be able to activate our pelvic floor properly, we have to be able to breathe. No amount of movement is going to wake up that pelvic floor correctly or untighten it or strengthen it and find that right balance. So let's chat about that a little bit, Whitney. What are some of your
Yeah.
tips for new moms or anyone listening to, like, again, if you've not worked on this, it likely still applies to you if you
Yep.
haven't worked on restricting and opening up your diaphragm, because if you still notice, like when you breathe and your shoulders go up and forward into your neck, then likely there's room for improvement on improving your breathing and improving stimulating your diaphragm.
Yeah, and that's where, so, everyone's so stuck on, oh, well, I can't do any exercise until I'm cleared at 6 weeks. In the PT world, breathing is exercise. Activating your transverse abdominis is exercise. It's just gentle exercise, and it's okay to start that day one. And so we just need to do it correctly. And starting to train that is going to gain a really good foundation to then, let's say you are cleared to exercise at 6 weeks. Now you're going to have a better foundation to work from and see progress faster. So I wish this was another thing. So all moms after a C-section should be given a handout. This is how you take care of
Mhm.
your scar. All moms should be given a handout. Okay, these are some of the things you can start doing in these first few weeks with your breathing, your posture, your body mechanics. The first thing we have to start off with the diaphragm is your posture. Because if you think about your diaphragm, you think about the bottom of your ribs. So we want our diaphragm moving up and down. Think of our trunk like a canister. We've got our diaphragm at the top, we've got our pelvic floor at the bottom. We've got our transverse abdominis, primarily giving some of the support in the front, some of our multifidi muscles in the back. But the canister needs to move up and down. As your diaphragm moves down, your pelvic floor moves down. As your diaphragm moves up, your pelvic floor moves up. So they should have a nice relationship where they're always kind of working together in the same motion. If you're in a really common mom posture of like the big arch, because we're holding our newborn babies and we're standing and we're arching our backs. Now you've tipped your rib cage back. And so the bottom of your rib cage is now tipped so that your diaphragm is now going down and forward instead of straight down to your pelvis. That right there is already going to put you at a disadvantage for your core. And so we have to have your ribs stacked right over your pelvis so your diaphragm is moving up and down so we can also get the appropriate pelvic floor activation. So posture is number one thing to start to think about. Same thing with the slouching. So if we're slouching, then it's going to compress pretty much everything in your abdomen. And so then you're not even going to be able to get any diaphragmatic breathing there because it's all just so stuck down. So first thing is posture. With the diaphragm, I typically teach everyone more of that 360-degree breathing. We always used to teach belly breathing, but it's much more than just the belly. And so I like to teach kind of imagining your whole rib cage and abdomen as a balloon. And when you inhale, your whole abdomen and rib cage is expanding. And so what happens with that, when we inhale, our diaphragm actually moves down, which seems counterintuitive. A lot of people think, oh, when I exhale, it must move down because you're just like, ah. But really, your diaphragm moves down when you inhale, which means your pelvic floor relaxes on the inhale. And so when we inhale, then as the diaphragm moves down, it's kind of like we're getting a nice, good expansion all around along our belly, along the front of our ribs, along the sides of our ribs, and all the way into our back. And so we want that whole 360-degree breath. When we inhale, everything expands out. And then when we exhale, everything comes back together. And when we exhale, that diaphragm's now moving up, and our diaphragm's like a dome. And so now it's moving back up and it's pulling the pelvic floor up with it. And so that's typically how I teach some of the diaphragmatic breathing. A lot of times that 360-degree breathing is what I like to call it.
I love it. You just took all the words out of my mouth because that's essentially how I teach it too, because we have to activate so much more inside of our body than just the belly breathing. And it's amazing. I will cue people to breathe into their back. And one thing for ladies
Yes.
listening, if you haven't heard me talk about this, just because I have so many women that have a hard time, they're like, I don't know how to breathe into my back. So an easy way to start doing it is laying on your stomach and practice breathing into like kind of where your bra line is, and then breathing all the way down into your sacrum, just to be able to start to feel that. And it's amazing to me how when we start to improve our breathing, we start to release so much tension in our body. And so we talked
Yes.
before a little bit, right, about the trauma that we can hold in our body from birth or heck anything else, right? And because of those things, then when we tend to hold on to stuff, that in itself can start to restrict our breathing. So when we start to open up our breathing, we start to really activate and wake up and release stagnation that we've been holding in one way or another. And we hold so much stuff up in our rib cage. And I always feel like, and Whitney, please speak to this as well, that, there's so much stuff that's going on in our rib cage, right? Inside, we have got our heart and our upper organs, and we've got a lot of fascia and our intercostals and all of that. And like, yes, you can do manual work to start to release some of that, but to get deeper inside, the best way is really just to improve your breathing to help to open up and soften that tissue and create space and elongation and all of that.
Yeah, yeah. And that's sometimes I'll have moms do the foam roller for the thoracic spine, just going from the bottom of the ribs up to the shoulders, just lying on your back and going up and down there. Sometimes people will feel like they just get better expansion after they do that because then they're not so stuck there. Um, the other
Clarifying
thing,
with using a soft roller, something that's soft, just so, or like a soft ball works as well too. I just want
and
to
if you
clarify
use the
that it's
ball,
soft instead of it being hard.
yep. And if you use
Yes.
the ball, it's great to use against the wall because
Mhm.
then you can do like little squats against the wall and then you can decide how much pressure to push back.
Yeah. Yeah. The
Um,
wall is always a good place to start, especially if you've ever had any history of any rib stuff or ribs going out, things like that. Just an added side note for Whitney, just for any of our ladies listening, that I love that release that you're saying on the floor for
yeah.
sure. But yeah, starting on the wall can just sometimes, if you're not sure, or you're a little hesitant, I like the wall and then moving on to the floor, but that can definitely help open up for sure.
Yeah. Well, and it's interesting, how you say how we can get all of this tension and stuff that could be from our breathing. I had one patient, now this was a few years ago. She she was like 7 months postpartum, and I had never worked with her before, but she had heard about me, and she wasn't having any pelvic floor issues. She had a easy vaginal birth, just never really pursued any pelvic floor PT. But she reached out to me because I work all pregnancy and postpartum, and she was having these like heart palpitations and shortness of breath, and I started getting panic attacks and had all of this stress because she was having all of these seemingly like emergency type symptoms, like her heart, her lungs, like this is a big deal. She went and saw a cardiologist. She worked with a pulmonary doctor. She had all these workups for her heart, for her lungs, for her nervous system. She saw everyone, and every single test came back normal. And they were just like, we don't know, like you're in good health. And she had just reached out to me to just be like, have you ever heard of this? I know you work with moms all the time. Have you had other moms who have had this? And as she was describing her symptoms, I'm just like, man, it could just be your diaphragm. And sure enough, I saw her for one visit. I worked on releasing her diaphragm and just getting that expansion again, and she never had the symptoms again. Like that's how impactful our diaphragm can be. So
That's
that has
amazing.
always stood
Yeah.
out to me as like, wow.
Yeah. Thank you for sharing that. It's so interesting too that you mentioned that because I will tell you, like, the longer I've been doing the work that I've been doing, and the more and more I'm having my ladies do more ball work. Do you know why? I know you know why, but for everybody listening, because the ball work, it's so soft and so gentle, and it does two big things. It calms your nervous system because it's soft and gentle, and it improves your breathing because it gives your brain a tactile cue feedback of where you want your breath to go. Because I'm having my ladies do more and more rolling, like kind of what we were talking about at the very beginning, right, with the release of the low back during
Yeah.
pregnancy and postpartum, and then up into the ribs and into that mid back. And it is amazing how it can really, it opens up a whole new world for them in their body. And more and more when I'm seeing, if I see someone who is kind of stuck in a pattern, and I'm like, do more ball work, because sometimes we're stuck in that pattern because it's a little bit of that fight or flight. So we're a little bit of our nervous system is stuck in that. And then we're also stuck in there. Partly it's like a chicken and egg thing, right? Also because of that breath and that restriction in the diaphragm and in the breathing and in the rib cage. And obviously, if we're stuck there, then we're stuck in our pelvic floor. We're not able to efficiently activate our core. I don't know, I just find it so interesting and fascinating how, again, it's so all interconnected. And like the story you shared, you wouldn't think of those symptoms being, oh, my diaphragm's just locked up. But it's
Yeah.
amazing. It's
Well, and
interesting.
it's so, I'm sure but like our vagus nerve, I mean, that is so involved with the fight or flight and the stress and the anxiety and stuff. Breathing is how we calm that down. So that vagus nerve plays a huge role with all of that, and that is like the first thing you do to try to calm down the central nervous system is just getting the breath work and calming that vagus nerve.
Absolutely. Okay, so Whitney, let's chat about sex and postpartum because I feel like it needs to be talked about more. We don't talk about it. I feel like women are just like, oh, 6 weeks, I get the clear to go ahead, and like that's the extent of the conversation
Yep.
that goes on for moms, right? But maybe moms are having pain. And again, regardless of cesarean or vaginal birth, and please speak to both of them from your perspective and what you see and what you recommend and what comes up for your moms.
Yeah, so sex after baby is a very, very common symptom.
Mhm.
And unfortunately, our medical system has pretty much normalized that along with all the other things that happen postpartum. And so a lot of times they're just like, oh, yeah, well, you just had a baby. That's just how it is. It'll probably go away. But it's not necessarily just going to go away on its own. We have to figure out why it's happening. So for some people, there are three main causes of pain with intercourse. One is vaginal dryness. And so that is a normal thing. So normally I say, okay, we've got common and we've got normal. Most things postpartum are not normal, they're just common. But vaginal dryness is a hormonal thing. And it's because of our decreased estrogen levels, our vaginal tissue can become drier. And so that can sometimes cause some pain with more friction. And so, what I typically have people do, or when I see someone who's having painful sex, the first question I ask is, are you using lube? So, use lube. If you have pain with sex, that's the first thing to try. If you use lube and it takes away all of the pain, then it's just a dryness issue. That will get better over time, especially as the hormones start to regulate and kind of normalize again. For some people, that can take for as long as you're producing milk and up to 3 months after you're done. So
Mhm.
for some people, that might last a long time. So that's one cause. The most common cause is pelvic floor muscle tension. And so this is part of the problem. We don't think about our pelvis and our pelvic floor like any other muscle in our body. And so just like how we can get knots in our back or in our shoulder, we can get knots in the pelvic floor. They're muscles. And so just like any muscle externally, where you can use the ball and you can do trigger point release and get those muscles to soften and release, we do that for the pelvic floor. Just that to get to those muscles, we have to go internally. Every once in a while, I mean, you can do a little bit externally, but a lot of times it's the internal work where we're actually going to get these muscles to really fully let go. And so, internal pelvic floor work, I typically, if you have a pelvic PT in your area, absolutely see a pelvic PT because they can at least teach you how to do it right. I typically teach people if you're going to do it on yourself, we've got different tools that you can use. But I personally like to just, if you're doing it on yourself, use your thumb because then you're going to be able to feel what's happening under your fingertip. And so we look for the knots pretty much is all we do. I normally have people go internally and kind of look at the vagina like a clock, where up towards the pubic bone is 12 o'clock, down towards the tailbone is 6. We don't go up. That's for the professionals. The urethra is there, and I don't like people messing with their urethras. So I normally have people work kind of in that 3 to 9 o'clock range, and you just gently, gradually increase your pressure until you either feel that you can give yourself a good amount of pressure and it feels nice and soft and springy and there's no tenderness, or maybe you start to press and you're just like, oh yeah, that kind of hurts, just like a trigger point in your back. And so if you find some discomfort, I normally say maybe it's in that 5 to 7 range. Hold a constant pressure, wait for that muscle to soften, then you'll notice that the tenderness is going to go down. That's like in a nutshell how we treat pelvic floor tension for pain with sex. Some of the different tools like a dilator set can be really helpful. I actually have some of my moms so that muscle tension is a real thing. That's not just in your head, and you're not just causing it to happen. For some people, they have been in such significant tension, you can't just relax the muscles, even though that's what a lot of times the doctors will say. The number of
Just
times I've
relax.
heard, yeah,
Yeah.
right, and the number of times I've heard like, oh, just have a glass of wine and relax, and it'll be fine. I'm just like, no, that's not good advice. We need to figure out why it's happening. And so doing that trigger point release, the dilators can be helpful. Some of my moms who have a lot of fear and anxiety about having sex the first couple of times, some of them, even if their pelvic floor feels really good to me, where I can feel nice, soft springiness in their muscles, It doesn't hurt them. They don't have any discomfort. They just have a lot of fear and anxiety around it. I'll have them get dilators just to insert it themselves, start gain that confidence so that they're just like, okay, I can do this. That felt okay. Do in and out motions with it, get the body used to that movement, move up to the next size. And the first one is like the size of my thumb. And so you start small, you're just like, okay, that was fine. And you just keep working up in size until you get to the larger size. And then you're just like, okay, that felt okay. You can kind of get over that mental barrier. And some people will do that right before intercourse so that then the muscles are nice and soft and flexible. And then you're going to go slow and you're going to use lube. And so that can be a really good tool for addressing some pain with intercourse. The other thing I have people do, so a lot of times people are anticipating the pain. And what do we do when we anticipate pain? We just
We
tense and
tighten.
guard. Yep. And so if we're tightening those muscles, a tight, tense muscle, when you press on it, is typically going to be painful or uncomfortable. And so then instead of thinking about squeezing, or if you notice, do a little check-in with the pelvic floor. And if you notice, oh yeah, I'm kind of squeezing my pelvic floor, well, then we need to let that go. So I normally will do visuals like dropping a marble down and out, or imagine spreading your sit bones apart, or imagine blooming a flower. So there's different visuals that you can do to help those muscles relax. So that will help then with penetration. So we've got vaginal dryness, pelvic floor muscle tension, and then the other big one is perineal scar tissue. And so you're not gonna, if you had a C-section, you're not gonna have perineal scar tissue, but you might have really tight pelvic floor muscles. And so that could be the main cause, or the estrogen, the vaginal dryness. But if you have perineal scar tissue, again, even though this scar tissue inspired vagina, no one thinks about like, oh, there are muscles there. Think about how scar tissue impacts muscles. And so scar tissue, like I said, anywhere in our body, scar tissue can become adhered, and that includes at our perineum. And so the scar tissue at the perineum, we need to massage just like we would an ACL tear. We just like we would a C-section scar. Any scar in our body, we should be massaging. So with that, again, we have to wait till you're all clear. The OB or midwife says that it's healing well. And then we need to start massaging it. So massaging it, I normally have people start with like inserting their thumb a little bit vaginally and have their finger externally right at the scar. And you can kind of just like rub your finger back and forth. If it's restricted, you'll find it. It will feel kind of like a guitar string or a little bump, and it'll likely be a little tender if it's restricted. And so then you just start with massaging it in little circles, side to side, up and down. Then I have my moms kind of grab that tissue and move it up towards their head, down towards their feet. That is actually going to be the most important part for pain with intercourse. Because otherwise, it's kind of like they're hitting a wall with every penetration because that scar tissue is just not moving. And so we want to get that mobility up and down, and then we can kind of roll it between the fingertips. And then this is super important for your pelvic floor muscles. If that scar is really stuck down, well, now your pelvic floor muscles might be stuck. And so you're not going to get as good of a closure. And maybe now you have urinary incontinence because those muscles can't get a good closure because they're being held open by that scar tissue. And the other thing I typically have people do, well, I don't have a lot of people do this on themselves, but if you are having poor perineal scar tissue healing, like I just had a mom this morning, her scar is not healing well. And it is because her pelvic floor muscles were too tight. And so I've had quite a few moms where like we've had our 6-week postpartum visit and they're just like, oh, I'm not cleared yet. Should we postpone the visit? I'm just like, no. We need to keep this visit because there's a reason why your scar is not healing well. And it's probably because your pelvic floor muscles are too tight and constantly tugging at the suture site. And so once we release the pelvic floor muscles, which we do externally, once we release that, then all of that tension and tugging comes off of the scar and it will start to heal better. And so with some of those moms, I wish we could identify them earlier. You know, you're you leave the hospital or the birth center, or you're at home if you had a home birth, and then you're not seen. No one's checking you down there for 6 weeks unless you are having
Right.
big issues and you like demand care. And some of these moms, if I could have gotten to them at 2 or 3 weeks to really just start gently releasing the pelvic floor muscle tension, it's super gentle. That can then help for better scar tissue healing. But that's
Yeah.
kind of like a little side note on that.
No, I love it because that's why we're having this conversation because more women, moms in particular, need to know about this so that they can search out a pelvic floor physical therapist in their area to work with even before pregnancy, if possible, during pregnancy, and after babies, no matter how long it's been, because I think it's always good to work with someone in person, but then also then learning the movement techniques and the breathing and all that, because even with the restriction through the pelvic floor, and I know we've talked about this before on a last interview that we did, was the restriction through the pelvis because of the glutes, the tucked pelvis. All of that can also lead to restriction in the pelvic floor. And so also for women to understand, like we need to also work on posture, but our mobility and how we're moving and how we're working out and doing those types of things. It's looking at it all together. And I love that you teach that too. It's all about looking at how everything is connected. We're not just segmenting the pelvic floor on its own, which is what I love about the work that you do, Whitney, because you do such a good job at always, clarifying to everybody, like, look, everything's all connected in the body, and that's so important. And we just need to be having these conversations more so moms can go in with this knowledge to be better prepared. And so for anyone listening that you're like, oh, I wish I would have known this, then share this conversation with any moms that you know, any women that you know that are going to be moms in the near future or in the future at some point, because it's never too early to start to learn this. And I even think too, having two girls myself, and one of them is a teenager, and they don't learn a lot about their body. They learn like,
No.
I don't even know, like they learn crap. And I'm like, I teach my kids quite a bit about their body because I'm a body movement person. And I teach it to them in a way just to empower them so that they feel more empowered in their own body. And I think especially girls, when they're that teenage age and they're cycling and, hopefully you're having the conversation about, you know, not getting pregnant and all of those things, even when they're little bit, teach them about their body, teach them about the parts of their body. So
Yeah.
then when the day comes, these conversations hopefully are going to be easier and they're going to be more aware of like, well, I know these areas of my body. I know my muscles of my pelvic floor. I know there's muscles there. They just are going to be so more empowered. I feel like every conversation, Whitney, I have comes back some way, shape, or form. I'm like, how can we help women be better prepared? Because like everything we're talking about, when I had my first, I knew none of this. And
Yeah.
I was working, this is what always like shocks me every time I go back to like, okay, when I was in college and I was studying prenatal exercise and all of that, it was more about specifically like exercise in relation to VO2 and all of that and heart rate and is it safe for mom? We didn't talk about pelvic floor. There's no conversation 20 years ago about even
Yeah.
what pelvic floor was. And I was learning all this stuff about exercise and pregnancy, and I learned nothing about the pelvic floor because we didn't talk about it. We didn't know a lot. So much has changed. And that's why we just need to keep having these conversations. But I keep coming back to like, we need to educate girls
Yeah.
when they're learning
Absolutely.
about their bodies. And sorry, I totally went off a tangent on that, but I get so just passionate about it because I see that if we can teach girls younger about her body, she can be so much better prepared to prevent and be better prepared for these major changes in life of pregnancy and C-sections and whatever life throws at her, really.
And then you open the door to have these conversations, right? So, like, my daughter's 8. It was probably 2 years ago now. We, like, one of the little beginner books I like for parents to use with their kids is one of the books called Amazing You. And they do a good job about just like talking about the private parts. They do use the word vagina instead of vulva, but oh well. Um, but my husband was actually reading her that book. She picked out that book at night, and my husband was reading the book to her, and I was off doing something. And she was just like, Dad, can you show me my private parts? And he's just like, well, your mom is actually the expert of this. So how about we go over to her and she can teach you about your private parts? And so she came over and she was 6, and I was like in the bathroom. I grabbed the little hand mirror, I grabbed a little Q-tip, and I was just like, okay, these are your labia majoras. This is your perineum. This is your vagina. This is your anus and your anal sphincter. This is your clitoris. And so we're just naming the parts. And she's just like, okay, cool. And so she knows the parts of her body now. And to have like these open discussions, like she's not going to be afraid to ask us questions, like when she does get her period and some of these things. And and I just feel like that empowers when we know more about our bodies, we know what questions to ask. We know that we can ask questions. And then we also know that we can uh, demand better care and demand help when a lot of times we're kind of overlooked.
Yeah, absolutely. Oh, I love this conversation. Whitney, I'm going to have you back on. We're going to do a whole pediatric conversation just for everybody listening, because you work with peds too. And I get very passionate about kids because, well, that's how we're going to change things, right? Is helping to
Yeah.
change what we're teaching with the kids. So, Whitney, to wrap up, because I know we could keep talking about so many things that we want to talk about, but in keeping with today's conversation around scars and painful sex after baby, is there anything else you feel like you really want to add? You've had shared so many amazing nuggets already, so I am very grateful for you sharing all of that. But if there's any last things that you want to share with everyone listening.
A lot of it, I talk to all my moms about this. We need to just listen to our bodies. Like, if something doesn't feel right, it's probably not right. And so most of these things, we can fix all of this. If you're having pain, that's not normal. Pain is never normal. If you're having pelvic pressure, heaviness, feeling like something's falling out of your vagina, that's not normal. If you're having leaking, it's not normal to have any of these things. It means that there's some sort of dysfunction going on. Either it's muscular, it could be fascial, it could be coordination of the muscles, it could be a few different things. And we have resources out there. You just need to reach out to them. And even if your primary care or your OB, or you reach out to one of the medical professionals and they're just like, it's fine. Or, you don't need pelvic PT. It's still okay to pursue help, even if our medical system doesn't do the best job of supporting women through any type of symptoms we have. So a lot of it is we just need to listen to our bodies, and if there's something going on, then let's actually try to do something about it instead of waiting years until it gets progressively worse.
So, such wise advice, Whitney. I love it. So, will you share with everyone where they can learn more about what you do? I do know you are teaching some online workshops now, and you are located in Orange County, California. So, for anyone listening and it's in the Orange County area, that's where they can work with you one on one. But other than that, let them know where they can reach out to you online.
Yeah. So I have like the Instagram, Facebook, those social media things. I have a lot of posts. I haven't been active for a little while. Just I haven't had a ton of time. Um,
It's okay. Life
so
happens, right?
life happens. But I have a ton of like really educational posts on there. That was my vision when I like got the Instagram account was I want to teach moms and teach them good information that they can use. So it's just at Restored Physique. I do have that reel which shows how to do the abdominal myofascial release. I also have one about perineal massage or perineal prep of like how to do all the trigger point release stuff. And so Instagram at Restored Physique. Feel free to go to my website too. It's just restoredphysique.com. You can go through the contact form there or just directly at my email, Whitney at restoredphysique.com. I do have some online classes available for purchase. They could actually use code 75OFF, 75 off, for 75% off of those courses. I have two of them. One is about 2.5 hours worth of pregnancy related topics, and then the other one is postpartum. And then I also teach a free class virtually every month. Yeah,
Yeah.
and I'll have my calendar up on the website.
Awesome. Whitney, this is so great. I always love getting to see you and always love to chat with you. So thank you so much.
Yeah, thanks for having me.